Next, I'm going to examine the nose and the appendages of the nose, including the sinuses, and also remember, of course, that the eustachian tube connects from the middle ear to the back of the nasopharynx and is connected to the posterior nasal structures. So when we examine the nose, first thing we want to do is come to the front and inspect once again for symmetry. Nasal injury are very common in both childhood and adulthood. When you tilt the head back, you can look at the nasal septum, the nasal ala, and make sure that they're all symmetrical. Come back down. Another good way to check for symmetry is to take a tongue blade and run it from the middle of the glabella here between the eyes down to the middle of the columella in the upper lip. And it should bisect the face. That's a good way to detect facial asymmetry. Actually, facial asymmetry is not uncommon. Next, we're going to palpate the structures around the nose. Remember, the frontal sinuses sit here, but in the frontal bone above the eyes. They can be quite different in size. It's not at all rare to have an aplastic or underdeveloped frontal sinus with a very dominant frontal sinus on the other side. Maxillary sinuses are here in the maxilla, and they communicate to the nose through the complex that sits right up here at the top in the area of the ethmoid sinuses, which sit between the eyes. The sphenoid sinus is posterior, really in the middle of the head. It's important to recognize the pain arising in the sphenoid sinus is oftentimes referred to the vertex. So patients who come in complaining of pain right in the vertex, you should think about sphenoid sinus problems. We should palpate these areas, gentle pressure over the frontal bone, also gentle percussion on the frontal bone may detect tenderness. Look for any erythema and obviously any swelling. Same over the maxilla. And you look for erythema, any swelling, gentle pressure on the maxilla. Any pain there?
Nope.
Okay. And then gentle percussion. Okay. Any pain when I do that? Great. Lastly, we can do transillumination of the sinuses. The fiber optic otoscopes are really quite good for this because they're cold and they don't apply heat to the patient. To transilluminate the frontal sinuses, you place the otoscope against the frontal bone and just at the supraorbital ridge, and you're going to inspect for light appearing in this area, and same on this side. Remember, asymmetry is very common. To transilluminate the maxillary sinuses, you have the patient extend his head, open the mouth, and we're going to place the light against the maxilla in this position, and we're going to look for light appearing on the hard palate inside of the mouth. If there's good transmission, that will appear pink and light. Same thing on the other side. Open your mouth and we'll look in there. Okay. And transillumination of these sinuses will look like this. Part of the examination of the nasal septum is to try and get an idea whether there's any extra tissue, thickening, hematoma in the nasal septum, or any perforation of the nasal septum. A good way to do that, in addition to just straight inspection, is transillumination of the septum. This involves shining light in one side of the nose, and I'll shine light in the left side of the nose in this case, and looking for the light being transmitted through the nasal septum. You should see a nice bright red glow. If the light comes through as bright and white, like it's coming out of the light source, then that suggests that there is in fact a perforation. If you don't see a bright red transmission, then it suggests there's thickening, perhaps a hematoma following trauma, or some other process that's infiltrating the nasal septum and obscuring the light passage. So we'll just shine the light in the left side, and we pick up a nice red glow on the right side. Sometimes best to take the nasal speculum off and get a nice transmission of light into the right side of the nose. It's easier to see this when you do it yourself as opposed to in the photography here, but it's a very useful technique. Let's try it once again. Again, light in the left side, and you're examining the right side, and a nice transmission of light through to the right side of the nose. So that's transillumination of the nasal septum. It's a useful technique, particularly after trauma. People who are struck square on in the face may come in with a lot of pain. You may not see much, but a large hematoma in the nasal septum is very important to identify because it needs to be evacuated immediately, or you may end up with permanent damage and perforation of the septum. Okay, next we're going to examine inside the nasal passageways. So we're going to tilt the head back and look in. Remember, the nasal septum is very tender. The anterior part of the nose, that inside of the nasal ala, is called the vestibule. It's covered by squamous epithelium with hair. This is an area where you may see small folliculitis or follicular infections. The turbinates are on the lateral aspect of the nose, 3 on each side, and we're going to look towards those. So, again, keep the nasal speculum aimed away from the nasal septum, as the nasal septum can be quite uncomfortable. You want to look along the nasal septum to see if there's any deviation. The middle turbinate on the lateral wall is what you usually see first, and then look superiorly, and it should be able to see the superior turbinate. Look for any mucus or drainage that may be exiting from either the nasolacrimal duct or from the maxillary and frontal sinus drainage into the nasal cavity. Another way of examining the nose is with the use of a nasal speculum. It's good to learn how to use this. It gives you a much better field of vision. To do this requires 2 hands free, so you will need to use a headlamp in order to assist. The advent of LED headlamps as opposed to hot bulbs has greatly facilitated this activity, and I just use my climbing headlamp. So to use the nasal speculum, you have a good light. And again, you tilt the head back. And the speculum goes in this way. Again, you do not want to do this, as that will run up against the septum and be quite uncomfortable. And this allows you to really give a very good view along the septum and then along the lateral wall and the turbinates. If you're going to approach epistaxis, it's virtually essential to use a nasal speculum to identify the bleeding points and get control. Next, we'll examine the mouth and the structures of the oropharynx. To do this, we're going to begin once again with inspection, examining the lips for symmetry. Have him open your mouth. Okay. Showing your teeth. Okay. Nice symmetrical contraction. Stick your tongue out. Okay, good. And now we're going to examine using the tongue blade. Proper use of the tongue blade is important. It should be held in this position so that you're using your thumb as a fulcrum. For best examination, start with the buccal mucosa. Just relax your tongue. And we're going to examine along the gum line, both superiorly, and inferiorly. Sorry about that. A little discomfort there again. Good. Next, we're going to examine along the gum line inferiorly. Gently retracting the tongue, lift the tongue to the roof of your mouth, and again examining under the tongue at the orifices of the submandibular and minor salivary glands. To examine the hard palate, you tilt the head back fairly far, open the mouth, and look at the hard palate, and here's the junction of the hard and soft palate. It's common to see torus, which is a bony prominence, usually in the midline of the hard palate. It is of no significance. To examine the oropharynx, again, open the mouth gently. The tongue should stay behind the lower incisors. It's a common mistake to have the patient poke the tongue out. That tightens the tongue and makes it more difficult to see. So gentle pressure then on the center of the tongue will reveal the oropharynx, the tonsillar pillars. Say ah. Ah. And when the patient says ah, he raises the soft palate and uvula symmetrically. While you're inspecting the oropharynx, you're looking for any drainage, any asymmetry of the oropharynx. Once again, and gentle pressure will give you all the exposure that you need in that area. Palpation of the oral structures can be very useful. And again, this is done gently. Anytime you suspect a lesion in the lips, tongue, or cheek, or the floor of the mouth, it should be palpated. You can get a lot of information this way in terms of size, consistency, and association with other structures. So to inspect the lips, just relax. We can turn the upper lip up and gently feel that. Lower lip going to be exposed. And we're going to insert a finger here and we're going to feel the cheek. Just gradually relax. Shut your mouth. By shutting the mouth, we keep the tissues relaxed, and I'm just rolling the tissue between my fingers. Okay, this is the area of Stenson's duct, the drainage of the parotid gland. Again, on this side, same thing. Good. That's not too uncomfortable for the patient. Nobody particularly goes out of their way for that. Next, we're going to examine the floor of the mouth. Again, gently open the mouth. I'm going to insert my finger along the lateral side of the tongue, inside of the teeth, and then gentle pressure, close slightly, and feel the submandibular gland right here and the structures of the floor of the mouth. Okay, how are you doing?
Good.
All right, good. Now we'll do it on the other side. And again, move slowly and gently, noticing any enlargement of the structures, any tenderness. All right, how are we doing there? Okay. Lastly, we're going to palpate the dorsal surface of the tongue. Tilt your head back, open wide. And when I do this, relax for a second. This is the one part where you may gag a patient and they may have a tendency to bite down on you. To protect yourself from that, I'm going to use a finger to push his cheek between his teeth. That way, if he starts to bite down, he bites himself before me, and that will reflexively stop that motion. So open wide, and I'm going to push here, and then just palpate the dorsum of the tongue. Okay, good. And that's very important. The tongue is a very large muscle and it can hide masses and firmness. If there's inflammation or infection, you'll feel that as induration or hardness. Asymmetry, lingual cancers, not at all uncommon in people who have been users of alcohol and tobacco, and palpation can identify lesions that you would think would be trivial by visual inspection, but when you feel them, you may feel a quite sizable abnormality. And that completes the oral examination. We will talk in another session about examining the nasopharynx and the larynx with the mirror. Fiber octaves are largely replacing the mirror in the hands of otolaryngologists, but primary care physicians should be quite proficient with using a mirror. It can give you a lot of additional information, and with a little practice is not difficult to do, and we'll do that in a subsequent session.